Good morning all. Today we are going to see some few clinical pictures of regressive alterations of teeth. So what are the regressive alterations? Your attrition, abrasion, abfraction, erosion. These are the regressive alteration, and also your external resorption of tooth, internal resorption of tooth, hypercementosis. All these comes under regressive alterations of teeth. So the first feature which we are going to see now is the attrition. What is attrition? The physiological wearing away of the tooth structure is called as attrition. In this picture we can see the wearing away of the incisal edges of almost all the teeth, your anteriors and posteriors. So this is called as the attrition, and this is a physiological process. As for the elderly patient, as the age progresses, attrition will be more predominantly seen. This picture also shows the presence of attrited maxillary incisors and mandibular incisors. We can see the dentin and the pulp tint. The yellowish tinge yellowish tinge which resembles the dentin and pulp canal can also be visible. So this condition is called as attrition, which is a physiological wearing away of the tooth structure. This is because of due to excessive occlusal forces. The second feature is the abrasion. So what is abrasion? This is the pathological wearing away of the tooth structure. So due to excessive force while brushing or because of any tooth biting habits, there will be presence of wearing away of the tooth structure, which is the abrasion. So the abrasion will be visible as wedge shaped structure in the cervical 1/3 of the tooth. So the first picture shows a clear wedge shaped structure in the mandibular premolars, and in the second picture it can be viewed in the maxillary premolars and molars. So this condition is called as abrasion. So the next picture, this is because of the excessive force while brushing, there will be presence of gum recession which causes abrasion. Here in this picture also the wedge shape can be clearly seen. So this is called as abrasion. And the third feature is erosion. So what is erosion? Erosion is because of the change in the pH of the oral cavity or pH of the environment. There will be presence of dissolution of the hard tissue substances or the hard tissue tooth surfaces. So this condition is called as erosion. One feature, this can be classified, the etiology of erosion can be classified as intrinsic and extrinsic factor. So the extrinsic factor mainly includes the carbonated drinks and the acidic pH with substance. So whereby there will be dissolution of the enamel and the dentin and pulp is being exposed. In case of intrinsic factors, the patient suffering from GERD, which is your gastrophageal esophageal syndrome, there will be a reflex acid presence in the oral cavity which causes the dissolution of the enamel structure. So this condition is called as erosion. In this picture, the first picture and the second picture, we can see the dissolution of the lingual surface of enamel of all the teeth, where thereby your dentin and pulp is clearly exposed. The yellowish dentin and the pulp is clearly exposed. So this is also one more example for your erosion. In this picture we can see the evenly all the lingual surfaces, the enamel and all lingual surfaces has been dissolved. So this is the difference between attrition and erosion. The attrition of the whole of tooth structure will be worn away, whereas in erosion only the portions of the occlusal surface will be worn out because of the increased acidic content. See, in this picture there is an imaginary line which is predicting the full surface of the full structure of the tooth structure, whereas in the second picture, the erosion picture, there is the wearing away of the occlusal surface because of the increased acidic pH of the oral cavity. The fourth one is the abrasion. So what is abrasion? Abrasion is also because of the excessive forces which is applied in the soft tissue and hard tissue which causes the wearing away of the tooth. This involves the root surface. The cervical third of the root and the cervical third of the tooth is also being worn away. So this condition is called as, this will be spoon shaped, whereas your abrasion will be wedge shaped. The scooping away of the tooth structure, this is called as the abrasion. So we will see the difference between attrition, abrasion, abfraction and the erosion. So attrition has the occlusal surface is involved and it involves the whole tooth structure. This is a physiological process, whereas abrasion is because of the excessive forces given to the tooth surface. Erosion is because of the change in the acidic environment, and abrasion is because of the excessive force given by brushing. So that abrasion is the pathological, only your attrition is physiological in nature, whereas the all others are pathological in nature. So this is also one more example for the comparison of attrition, abrasion, erosion and abfraction. So now we will see about the external resorption. What is external resorption? Because of any pathological condition present underlying the normal tooth structure, there will be resorption of the either root surface or the any other tooth surface. So this condition is called as external resorption. One of the etiology is presence of impacted tooth or any cyst or trauma or neoplastic conditions. There will be an inflammatory response which leads to the resorption of root of the tooth structure. The other condition is internal resorption, where there will be presence of inflammation of the pulp core, and there will be increased inflammatory reaction which causes increased blood supply, and there will be the resorption of the tooth structure internally. Internal resorption is also called as pink tooth. The other condition is presence of hypercementosis. Increased deposition of cellular cementum in the root surface is called as hypercementosis. This condition is caused either because of any trauma or it is unknown. The etiology is unknown, and there will be presence of there will be increase in the size of the root. When compared to the other root, the hypercementosis root will be more in size, so it will be difficult during extraction process. So this picture shows the presence of bulbous root. So in this video we saw about the regressive alterations of teeth, which includes attrition, abrasion, abfraction, erosion, external resorption, internal resorption and hypercementosis. This is apart from your attrition, all other conditions are pathological in nature. Your attrition alone is a physiological wearing away of tooth structure. So with this we complete this video. Thank you.